And that's really important too, because I'm frequently contacted, and I'm sure you are as well, by individuals interested in the program. And so they might say something like, does functional medicine work for fibromyalgia? Does functional medicine work for chronic fatigue? Does functional medicine, of course, work for MS? But what's hard for some folks to conceptualize is that when we're talking about functional medicine, these distinctions of separate diseases sort of disappear to a degree, because we're moving, as in the analogy typical of functional medicine, from the distant branches of the tree down toward the trunk and toward the roots. And when it boils down to the trunk and the roots, there are really only a handful of fundamental imbalances that contribute toward these diseases that we use as labels. And so functional medicine really distills out those basic lifestyle factors, the typical imbalances that we might see using advanced laboratory testing, whether we're looking at micronutrient balance that affects the body's ability to produce energy, as an example, or whether we're looking at metal toxin exposure, the need for essential elements, or whether that person's amino acids are sufficient to meet the body's needs for amino acids, whether they may have an imbalance in their gut microbiome, whether they have imbalances in their ability to digest food for a variety of reasons. Those are actually the imbalances that create these separate diseases. So it's really important for folks to understand that as a functional medicine doctor, we're just focusing on a different level. Yes, it's important to know what disease that person has, because that's one of the things we use to track, how are you doing? Oh, my MS is so much better. I haven't had a flare up in the last, how long, year or whatever. My MRI is stable. I'm now able to walk 25 feet, twice as fast as I could, or my brain fog is gone, my energy is improved, my fatigue is less, right? So it is important to know those diagnoses, but important to also understand that we're not directly treating those diagnoses, we're treating the root causes. Treating the diagnoses is a drug. Treating the root causes is functional medicine.